Thanks, Jessica, for leading us off in the chat. Folks, if you want to take the opportunity now to introduce yourself in the chat, let us know your name, what organization that you're representing today. And thanks again for joining us. We're just going to give it another minute while we have some more folks join us and we'll get started. All right. Well, we have 12:02. I want to respect everyone's time and be mindful, especially over the lunch hour here. So, I want to thank everyone for joining us and welcome everyone to the first installment of the RTA's 2025 Transportation Tuesday webinar series. This is part one of our four-part series this year. So thank you again for joining. We do have three additional Transportation Tuesday webinars in the subsequent Tuesdays to follow this month, which you can find a link in the chat to register. You can also find that on the RTA's website. We're very excited to kick off this series today with a public engagement meeting for the update of the region's Human Services Transportation Plan. My name is Robert Morris. I'm a principal analyst here at the RTA. I'm serving as the project manager on the RTA side for this project. And I'll go ahead and introduce now Laura Brown. And Laura, you can come off mute and introduce yourself.
Thank you, Robert. Hi, everyone. My name is Laura Brown, and I am with RLS and Associates. I am the consultant team project manager for this study, and happy to see you again. If you participated in the last coordinated plan, I already recognize some of the names, so good to see you again if we met before.
All right, guys, we're going to jump right into today's agenda. And I'll pass it over to Laura.
Great, thank you. So we have an exciting agenda for today. We're going to first go over, Robert is going to present outcomes of the prior study, the prior plan that was done back in 2021. It has a range of goals that we worked on together with a lot of public input, just like the meeting today, and then the outcomes that have happened since then. So it's great to hear that update. Then we'll move into the current project. So we'll focus more on give you an overview of what's involved in our update to the coordinated transportation plan and the timeline for that. And then the real good part, the best part of the meeting is our discussion. So we're going to break out into groups in different rooms to make the sessions a little smaller, and we can have more of a discussion with the team lead in each group. And that'll take maybe 25 minutes or so. And then we'll come back together and close out with what you can expect going forward and some opportunities for community input. And I think this is for Robert. Was this one yours? Do I turn it back to you now? Or do you want me to keep going?
Yeah, that's fine. So this is the update of the Human Services Transportation Plan, which is a regionally coordinated transportation plan for the Chicagoland region. The purpose of this plan, we have a few here outlined, but essentially is to identify the transportation needs of individuals with disabilities and older people with seniors and individuals with low incomes. The priorities are to identify gaps in our access to transportation throughout the region, as well as providing strategies to meet those gaps and to meet those needs and closing the gaps. We will also prioritize and goal set for our transportation services and identify projects for implementation, as well as funding for the next 5 years. A little bit about our previous HSTP that, like Laura mentioned, was adopted in 2021. So the RTA does serve as a designated recipient for federal Section 5310 funds for the Chicago region. Uh, the uh, This is aimed at enhancing mobility for seniors and individuals with disabilities. The Human Services Transportation Plan, or the HSTP, as we call it for short here, is a requirement for federal funding and must be locally coordinated and updated every 5 years. There were 9 key goals from the previous plan that we identified, and I want to update this group today on the implementation of those 9 goals. The implementation has been taken on by numerous agencies, not just the RTA, but also our transportation operators in the region, county and municipal governments, the Illinois Department of Transportation, or IDOT, the Chicago Metropolitan Agency for Planning, or CMAP, human services agencies, and nonprofit organizations, as well as private transportation providers and employers and community-based organizations that serve transportation disadvantaged populations throughout our region. An overview of those 9 goals that you'll see outlined here. I'm going to go goal by goal and update the group here on the implementation, the success of these goals, and some challenges as well. The RTA and regional partners have made progress on each of these 9 goals. I'll share those implementation highlights and again talk about some challenges as we move forward into our plan update. The first goal, goal 1, has seen considerable progress in developing a robust mobility management and travel training network across the region. Since 2021, the RTA expanded our mobility outreach program with the hiring of 3 outreach coordinators and a dedicated supervisor. Each coordinator specializes in a specific geographic portion of the RTA region, increasing the program's reach and community-specific expertise. The travel training program was relaunched in June of 2022, with 4 trainers now providing one-on-one instruction to seniors and individuals with disabilities on how to navigate public transportation systems. Like in our region, fixed route transit being CTA, Metra, and PACE. Additionally, the 2023 Section 5310 call for projects incorporated new scoring criteria to prioritize funding for mobility management initiatives, which led us to 2 new mobility management projects in our most recent call, CTF Illinois and McHenry County. Despite all of these successes, efforts to build a consistent and fully regional network of mobility managers does continue to face some hurdles with varying levels of engagement and resource availability across jurisdictions. Moving on, Goal 2 saw several noticeable advancements aimed at expanding service areas and hours of operation. McHenry County, through MC Ride, launched a pilot program in 2023 to extend operating hours from 6 a.m. to 7 p.m. to 5 a.m. to 11 p.m., a change that has since been made permanent to better accommodate workers in non-traditional shifts and those needing transportation for weekend and evening activities. Ride Lake County consolidated its previously fragmented services into a unified countywide program that now serves all seniors and individuals with disabilities in the county, an important step towards reducing confusion and improving service equity. Will County has also expanded its program from 6 participating townships now to 16, and more to be added soon, significantly broadening coverage. Remaining challenges are mostly due to the additional cost of expanded hours and any labor shortages associated with expansion. Goal 3, to coordinate fare media and cap fares, has seen an improvement as well, with especially relating to a more seamless fare experience for users in the region. Through the integration of Ventra, PACE has made it easier for riders to use a single payment method across services. For example, Ride Lake County now accepts Metra, which has already benefited over 150 unique riders in its first year. Goal 4, to increase volunteer driver programs. Volunteer driver programs can provide a cost-effective way to support low-density and off-peak travel needs. The Ray Graham Association facilitated a cross-agency collaboration study to pilot such programs. Significant challenges do remain on this goal, including difficulty in recruiting volunteers and mostly liability and insurance concerns. Um, we also have some increased competition from rideshare platforms like Uber and Lyft, and specialized skills and licenses that drivers need to interact with a specialized set of customers. Um, this is a growing area where we do need specialized skills, like I mentioned, to interact with clients with certain disabilities or older adults, and that can provide a challenge to growing these volunteer driver programs as well. Goal 5, access to suburban jobs. This goal addresses the disconnect between where people live and where jobs are located, especially in suburban areas with lower fixed route transit. Since 2021, the RTA has funded over 20 infrastructure projects at almost $8 million to improve mobility and safety near transit stops. Since 2021, the RTA has also awarded 34 community planning projects with a total budget of $3.35 million. In addition, the RTA has released a transit-friendly communities guide in 2025 to support municipalities in transit-oriented land use planning. Still, stronger partnerships with employers and a wider adoption of micromobility options are needed to help further close first and last mile mobility gaps. Traditional vehicle procurement has not always matched service needs. Agencies are increasingly seeking smaller, more efficient, and ADA-compliant vehicles. Programs like PACE's Rideshare Access Program demonstrate innovation by subsidizing Uber rides and Dial-A-Ride for paratransit users. RAP also certified ADA paratransit riders to take Uber rides within the service area shown on the map here. Riders pay $2 for rides up to $28 and then cover any overage there over the $28 limit. High costs and limited supplier options have posed a challenge for further expansion. Expanding procurement flexibility is crucial to support an ever-evolving service model here. Goal 7, to increase collaboration and consolidation in the region, has seen a lot of improvement here as well. Efforts to consolidate overlapping services, especially in Lake and Will County, has seen major progress. Ride Lake County has become a model for other programs to study and inspire implementation. CMAP recently conducted a study with the support from the RTA in Northwest Cook County to explore coordination of township services. Ray Graham Association has also led an RTA-supported coordination study looking at ways that human services agencies can coordinate routes, share vehicles, and work towards transportation efficiencies. Some route coordination has already begun with the participating organizations in the Ray Graham study. Despite all of these successes, many agencies lack the administrative capacity or technology infrastructure to fully implement a shared service model. Continued investment in coordinating tools and staff training will help unlock regional efficiencies. Goal number 8, to install a regional one-call, one-click system, has seen progress. A regional one-stop platformer does remain a key goal, but PACE's transit app pilot and trip check services show great potential in this area. These provide riders with trip planning and real-time management tools. Meanwhile, the RTA continues to support the regional call center for assistance. The challenge here lies in unifying fragmented systems and ensuring that platforms remain accessible and up to date. Technology investments and cross-agency collaboration will be a key to moving this goal forward. Goal 9 is an accessibility infrastructure database. Accessibility infrastructure is essential for safe and equitable transit access. Tools like CMAP Sidewalk Inventory and the website Project Sidewalk, a crowdsourced site that allows users to report on sidewalk and mobility conditions and allow agencies and the public to identify gaps. ADA transition plans have also become increasingly more prevalent, with a major investment in these plans from CMAP. Still, there are remaining issues with data consistency, format capability, and maintenance. Building a comprehensive and user-friendly regional database will require ongoing collaboration and funding. Now, these were the goals from our previous plan. And as you've seen, we've made great progress on a lot of these goals, but do have some remaining challenges in the region. Our next steps for this are to move forward into our 2025 HSTP update and identify what gaps are still remaining and prioritizing ways to address those gaps and setting goals for our update. Going to pass it back over to Laura Brown to talk through some key project tasks and milestones.
Thank you. The project going forward is really broken into two pieces, if we can think of it that way. And right now we are in the first part, which is listed here as data and information. So this is our opportunity to evaluate where we are today. So all the great progress that's been made since the last plan, to update the information, find out what transportation services are available in each county and across the region, and what are the gaps. And of course, the focus is on transportation for older adults and individuals with disabilities and those with lower incomes. That's the focus of this study, but it does encompass transportation for everyone as well. So we talk to public transportation providers as well as agencies and organizations that maybe serve a specific clientele or part of the population. And as we're doing that, we're updating their provider information and then also looking at the just demographic analysis, updating the statistics from Census Bureau and other resources that are trusted. We also have some focus groups coming up. I'll talk about that more later, and a public survey, which is already out, and we'll have the link to it coming up a little bit later too. Those things are ongoing and really important. And then, of course, this public meeting is our first public meeting for the study. Moving next to the next phase, which will happen in the coming month or two, maybe we'll just say fall, we start to move toward goals and priorities. So in that step, we take all that information, data and information that we gathered, and we make new goals like the ones that Robert just reviewed for you. Where can we either take those goals another step forward, or is there a new goal that we want to identify? And so the goals are tied directly back to the needs that we talk about today and the gaps and the things we find out through our interviews and surveys as well. So it's really important. This next thing we're going to do is talk about those needs and about the challenges you have. So just know that that information you provide goes forward, and it gets tied to the goals and strategies that we identify. And ultimately, everything will be prioritized and put into a draft and final plan. And we'll talk about that more at the closing. And then one final comment, we will have available very soon a story map, which kind of is a resource that anyone can use to get updates and information about the plan as it's ongoing. And information will be available from the RTA about that story map. It's not up yet, but it will be coming out soon. All right, next
All right.
slide. Yeah, go ahead.
Next, we're going to move into our breakout groups. These are going to be two different activities that we're doing, and we really, really do rely on the input that we get through this public engagement activity. So please do feel free to speak up, to speak up and let us know about some of your lived experiences. We'll ask you to share a positive story or a challenge that you faced. And we'll also ask you to do a little bit of visioning and think about what a really great transportation system looks like for you and how this transportation service regionally here in Chicagoland area can best serve your needs. So we will go ahead now and break out into these groups. We'll have facilitators in each, and then we will ask our facilitators and participants to tell us a little bit about what they shared and what they heard in those breakout rooms when we come back together as a group. Right. Should be seeing some rooms here and go ahead and click join.
Hi, everybody. I think there's some rooms that are still wrapping up, still in progress, but we're here. Hopefully everybody had a good discussion in their meeting group. As we gradually work our way back to the main room here, with everybody, we'll give that a minute. There's Robert. We'll give that a minute, to get everybody back together again, and then, kind of do a little recap.
All right. Thank you. Thank you, everyone. My breakout room, thank you to you all. I know we got cut off. We were still talking and coming up with ideas and questions. And so thank you to my group for your feedback and your engagement and all of the groups. I want to give our facilitators a chance to report back on some of the things they heard. We can start with Laura, and then I'll pass it to the rest of your team, and I can kind of finish us off. But again, thank you all for your robust participation. It's incredibly useful and helpful as we work towards creating strategies for the region here. Now, go ahead and pass to Laura.
I agree. Thank you to my group too. That was a really great discussion. Lots of good ideas I'll share with you. Um, so we talked first, about some of the challenges with transportation and, just I don't want to I'll keep it short, so I'm just scratching the surface here. But we have representatives in our group from several different counties, and some were transportation providers, some were riders, and there were discussions a little bit about frequency on the weekend, so of like train or fixed route services, not being as available on the weekends, which can really, make it harder to plan your day and get through everything you need to get through on the weekends. And then, that kind of trickles down to the um, ADA services, the paratransit service, as well as the dial-a-ride that also might be more limited and sometimes not even available, in some areas on the weekends. So that was a need and a challenge. And, also areas, there were a couple of counties. It was Lake and McHenry, I believe, were, specifically mentioned. I think I know it was Lake. I think the other was McHenry, about, not maybe having enough capacity to meet demand. They wish there was a little more capacity so that they didn't have to make, or they could make a trip reservation in advance, a week out, and there was still availability. But a lot of times, they're experiencing that even a week out, in advance is hard to get a trip. So, just looking at that capacity for more trips and more riders. We also talked about, uh, I'll call it accessibility. When you're boarding a bus, a large vehicle, one of the ones that has the ability to lower to kneel, and wishing that and hoping that it would be policy for that driver to kneel the vehicle, for any passenger at any stop, and, rather than the passenger needing to ask for it. And then also just safety once you're boarding and not pulling away until the passenger is sitting down, or is secure, for safety. So we talked about, a lot of things, but I can't get into all of that. But that's the gist. Another thing we talked about in terms of vision for the future, this group had some great vision. There was a discussion about, educating people about what services are available, how to use them, what would be the most efficient way to make your trip. So you might know of one service that's available, but there's probably other ways to do it that would get you there faster. And also just marketing to people who don't know about transportation or may not understand or appreciate it, and making information available for trip planning. So having the ability to say, I want to go from here to here, and plan that trip on different services, see what your options are. You can kind of do that on different apps now, but to have something really useful and helpful in the local area for that. I cannot capture it all probably. Let's see. Um, Oh, I really like this. I really liked all the ideas, but this one was good too about having information about what is at the different destinations. So, for example, you might be able to know Metra has a stop at, XYZ location, but it would be great if you could see somewhere connected to that what is at that location, what kind of shops are there, where can you go if you got off at that stop, what's offered. So connection information all the way through, not just about transportation, but about where you're going. And along those lines, really looking at service design also about where people are going and basing it on travel flow now and travel patterns and where people live and go, as we're designing the services and the hours and the routes. Also, maybe the medical community, doctors and hospitals providing transportation, or insurance companies covering the cost of transportation. Those are some highlights, but it was a great conversation. Um,
Thanks so
and
much, Laura.
yeah,
Um, Sounds like robust conversation in that group as well. The next facilitator I see here, William, if you want to go ahead and share some of the highlights from your group.
Yeah, perfect. I had a very diverse group who was very grateful and sharing a lot of great insights with us. So we kind of flowed through a conversation at first, talking about just the general travel times, challenges in facing trying to get to different routes, getting to different parts of the region that might not be covered by public transportation or by convenient public transportation from one county to another. And then we also talked a lot about specifically reverse commutes, which I think is something to take into consideration, particularly from the more urban areas in Cook County out into the other parts of the region. Ensuring that folks within the city have access, like we talked about a previous goal, to some of those suburban jobs, and those other suburban amenities that are out there, can be a challenge when you have commuter rail and things like that only operate in one direction in peak hours, or there's not other services to fill those gaps. We kind of then moved on to some talks about eligibility challenges with these programs, whether that's jurisdictional eligibility. So, a certain city or county having their own transportation system service that is only for those residents, and how to make those regional when your travel doesn't necessarily stop at a county line. We also talked a lot about the eligibility of certain programs, and how that can be really hard for riders to have to navigate three different programs. They have to make decisions on which program to enroll in, and how, is this one going to cost me more money because it uses a private provider that charges me surge pricing? I don't even know how much my ride is going to be at the end of the day. So things like that, understanding those various eligibility challenges, whether that's jurisdictional or programmatic, I think was really, really insightful for us to talk about. Finally, kind of on the good side of things, I heard that the expansion of individualized services, and when I mean that, I mean kind of more a smaller rider to driver ratio. So those on-demand services, your smaller vehicles where you can have maybe a little bit more touch points with the rider. Those have really helped out the human service agencies within the region. So giving the human service agencies a little bit more individualized service kind of helps them with their clients, maybe those with disabilities or those that need some additional help getting to their destinations. These services have been really helpful in the last couple of years. Let me flip over to the vision side. When we talked about the vision, it was great to hear that there is a vision to just have enough funding to run all the services that we need to run. So we're starting there. That would be great to have in 10 years. And then when we were talking about vision, we kind of focused in a lot on data and how to get data, specifically the right data, to the folks who actually need it in that moment. So transportation is awash in data. We have so many different metrics and things that we throw at people and throw at riders, but how can we better tailor the data that we're giving to riders? There was a great example for, how can we figure out a solution to if the only accessible seat on a bus is full and somebody else is trying to get on that bus? How can we solve that problem? There has to be a technology or some sort of data way that we can do that and give riders more information about the trip they're about to take. But also, how can we give human service providers more information about the trips that their clients are taking? And so the data pools needed for those two different populations is very different, and everything there would be completely different in terms of the technology needed, all of that. So those are the data vision, but two different data visions. So I will turn it over back to Robert.
All right, I'll throw it right back over to Jimmy, and then Amanda after Jimmy.
Great, thanks, Robert. So when we were talking about, and we had some good discussion in our breakout group, they kind of broken down into accessibility challenges, some on technology and fare payment, and some connectivity types of challenges. On the accessibility front, a couple things like rail station accessibility for visually impaired riders came up in terms of some stations being more well equipped than others. And both, I guess, for CTA and or Metra. However, there is an RTA helpline for that that can assist visually impaired riders. Sometimes some of the, we talked about elevator outages or some accessibility issues that just come up, which can be difficult for mobility challenge riders, or even with families with young children and strollers. On the technology, fare payment wise, Ventra app generally has been pretty well received, pretty helpful. Some of the issues though are when some riders may lack smartphones, or when they don't have the latest iOS installed, for example. That even can cause issues. So little things like that could be used for input back on that, improving that Ventra app. On the coverage and frequency, we got that Metra is generally well received for having hourly serviced for those commuter routes. But late night and weekend service is limited. And this is the same for Pace as well, particularly over the weekend. There's some service gaps. Let's see, some transfers as well. Some transfers between systems, between Pace, CTA, and Metra can be difficult. And we wrote down a couple of specific examples. So particularly on the commuter connection side, excuse me. And finally, wrapping up the first question on user experience and perception, we got some issues on some on-time performance for some CTA bus routes. Particularly, that can also affect perception if there are riders that see some delays or significant bus delays. So we talked about that kind of downstream effect that could potentially cause. And then for our future visioning exercise, I think it was generally can be summed up with having greater service frequency and connectivity. On the accessibility program side, like ride access and taxi access, essentially keeping those programs as is, or having those programs still being available to a greater extent would be ideal. And then having those better connections, right? So better headways, more frequency, late transit services going well late, not just weekday, but on the weekend. So that was generally the discussion that we had for that future lookout.
Thanks a lot, Jimmy. We'll go to Amanda, then I'll wrap us up.
Thanks, Robert. Going last, I have the benefit of hearing what all the other groups talked about and can just sort of fill in the gaps that maybe we haven't talked about yet. So our group talked I'm hearing some themes from what the other groups have been talking about as well, that we talked about in my group. And funding came up as well in our group, just to figure out if we have enough funding to run these different services throughout the entire year. That's especially when looking at coordinated paratransit, and making sure that those are consistent across the year. Looking towards understanding more about and connecting people to travel training services has come up as important, especially for those who are blind and visually impaired. Sometimes that information is given out through flyers or information that is not useful for that group. So making sure people have opportunities to get connected to that service. Looking, safety comes up a lot in sort of like the public outreach, that we talked about that as well, is just sort of continuing to collect information on that and understand what the challenges are for safety and getting to public transportation services. We also talked about Sunday service, especially out in Will County, I believe I have in my notes. So that was, I think, echoed in an earlier group too. On the visioning side of things, there was a few additional things I wanted to call out, in addition to what everyone else has already shared, but looking at real-time digital boards at more locations across the area, so that you don't have to rely necessarily on a trip planner app, and just be able to see like where services are going at the stop itself is really helpful. So that is one thing that I thought was an interesting feedback to bring up, as well as sort of getting to and from the stop, especially for older adults, ensuring, shade, shelter, benches, especially in the suburbs where you might already have to do a 15-minute walk to reach your bus stop. And then when you get there, if there's not a place to sit and rest until the service arrives. And then we also talked about there's a specific QR code service at stops, particularly in Spain, but this is sort of thinking about the vision of the future, that has really good accessibility for individuals, that you can use it to say how many feet away you are from the stop and which turns you need to take in order to reach there. So the idea of maybe seeing that in Chicagoland was enticing for our future. And I think there was a few other, we talked specific locations in terms of where they would like to see more service, especially to get to healthcare facilities or new venues and stuff, and how to advertise that to workers and visitors.
That's great. Thank you so much, Amanda. And thanks for all of our facilitators and all of our participants. I also facilitated a group, and I want to make sure that my group is heard as well. So I'll quickly add some highlights from our group. And then we've got a couple additional slides before closing out. I think my group did a great job of help telling their lived experience, but also providing a vision for a better coordinated future. So some of what I heard in my group were that some success stories to start us out. We had a participant share a story where their schedule changed last minute, and they were able to use the TAP program to be able to get where they needed to go and then back home. And due to kind of an uncertain nature of the way that their schedule changed, this program stepped up and was able to fill that gap for them. We also heard about how expansion in Will County has been able to give folks more medical freedom to be able to choose a provider of their choice instead of going to a provider that they were able to get to with transportation, but may not have been their preferred choice. And so now an expansion of the on-demand service in Will County has allowed them more choice in their lives, and especially related to medical services. We've heard that there is still a major need in rural areas and still barriers present in rural areas of our region. We've also heard that in my group that for the most part, this individual shared that they've had a lot of success with on-demand and paratransit. This individual lived in DuPage County, or lives in DuPage County. It's had a relatively positive experience, and that the rideshare program has also helped them, and that language barriers may have been an issue at first, but have been pretty easy to overcome. And then as far as visioning goes, I want to highlight something that one of the participants in my group said, which, because I thought covered it really, really in a great way. So this participant sees a transportation system that meets the needs of all individuals equally, wherever they need to go without barriers, while providing rides in the same amount of time that individuals that do not have disabilities or are dependent on on-demand service are able to get their transportation in. So, a lot of that has to do with cutting down on service times, and being able to get comparable service, and that individuals with disabilities deserve comparable service, and deserve the same amount of travel times. And so there's work to do there. So again, thank you to all of our participants. All of this feedback that we've got, we will put together and make sure that everyone's voices are heard, and that all of what we heard today is incorporated into our plan moving forward. I do want to go ahead and move forward. We'll have our contact information, Laura, and my contact information. So if participants have any further reaction or something that you meant to
We got rid of
include,
the self-check machines, huh? Too much shrink.
I'm sorry, what was that?
Yeah.
Oh, sorry. Okay, we'll go on ahead, but just wanted to say, if you do have any more additional feedback, we'll provide our contact information at the end, and please do feel free to reach out to us. Next, Laura is going to talk a little bit about our community needs survey. We do have our QR code here for that needs survey. And then there's also going to be a link in the chat. So please do feel free to tell us a little bit more about what your needs are and what your experience is here. I guess, Laura, I think we can probably just move on. We'll leave this QR code up for a few more moments here so that people can snap a shot of that if they want to.
Yeah, great. While you're doing that, the survey only takes a few minutes. It's mostly multiple choice, so I do want to encourage you to take it and let us know if you have any problems accessing it. We'll leave this slide up, but I'll just tell you in the interest of time about the next steps for the timeline for the project. So I mentioned in the beginning that we're doing kind of the existing conditions, the needs assessment, the outreach, focus groups, public survey, public meetings, all that fun stuff that we do, which is really fun. And it truly was great today to talk to all of you. We'll be doing that process through November of this year. So that's kind of an information gathering process. Then in November, we start moving toward the development of goals and strategies. So that's where we compile all those needs. We're also going to look at other communities for success stories or things we might be able to learn and glean from others now that we have more input from everybody else about the needs and your vision for the future. So we'll be doing that development and getting input as well on what the priorities are. That's going to start in November and go through March of 2026. When we hoped by that point, by March of 2026, we'll have a draft plan together and be ready to start moving forward. And then March and April, we'll just be building that, finishing it up, ongoing learning for the next steps so we can start working toward those goals and just keep the momentum going. That's the biggest part is to keep it going from now all the way through. So community and stakeholder engagement is going to be constant throughout. It'll be organized through the RTA, so that can be a good resource for you to go to for more information. And then finally, this is our kind of timeline again for community engagement opportunities. So you can keep an eye out for these things. Look, we are working with a project advisory committee. That is a committee that the membership is already set for. Some of them are here on this. It's a pretty large committee with representatives from throughout the entire region. We'll be meeting with them regularly, and they're advising us and guiding us through the process. So those will be again in January and then in March to finish out the project. We will be doing focus groups, and those are going to be happening in the fall as well. They will all be virtual, and there'll be small group discussions by topic area, like talking to riders, talking to agencies that provide transportation, talking to caregivers about just kind of refining what we're hearing from the public input. Public survey again is available online. It's throughout this month. If a print copy is needed, there's a way to get that as well. There's information in there. Or if you want to email me, if you're in here and you want to email me, that's fine. And this is our first public meeting. We'll come back together in December, so that's when you can get an update on where we are and talk about goals and priorities at that point, and then, or potential goals and priorities, and then March will be the final plan. Final
And
draft.
Laura, just wanted to touch on one thing, one additional detail on that public survey is that it's a SurveyMonkey link, and it is currently available online in both English and in Spanish. So that one link will take you, it'll ask you what your language preference is, and then we'll go from there. So if you choose Spanish, then you'll have the rest of that survey to complete in Spanish. If you do need any other language assistance or any accessibility assistance, please let us know. We're happy to accommodate. But please do share this survey with your networks. We appreciate you guys being here today, and we appreciate if you take our survey, but we'd also love if you're able to share this survey. We have we have a goal to get 1,000 respondents for this survey. So it's a lofty goal, and we need your help. And so please do take the survey, share it with friends, family, clients, coworkers, anyone that is involved in this space, or really anyone that takes transportation in the region. We'd love to hear from you.
Thank you. Yeah, I think that wraps it up.
Here's our contact information. Laura's email and phone number is listed first, and mine's following. So again, please do feel free to reach out. Any questions, comments, concerns, any accommodations needed for surveys or any other materials, please let us know, and we're happy to help out. And then I do see a hand up. Adam, you can go ahead and go off mute if you got a question.
Yes, and forgive me if I'm just a lazy, blind senior citizen, but if you have the emails of all the participants, could you just email us the survey automatically, and that'll help you towards your goal of 1,000 participants in the survey?
Yeah, that's great feedback. Thank you, Adam. I'll discuss with our team just to make sure we're able to do that. We'll absolutely reach out to you specifically just to make sure that you've got it in your email, and we'll see about sending that out to the entire group as well. Thanks for the suggestion.
Thank you very much. I greatly appreciate that. Technology still challenges me. Have a good day.
No problem. Thank you very much. All right, folks, if without anything else, we're just about at time here. So thanks again for all your time, for your feedback, and your continued feedback throughout this planning process.